Welcome to Nurse Connect. This is your preferred YouTube channel for learning purposes. Just remember to subscribe at any time that you visit, or you can probably share the channel with others. In this discussion, we'll focus on the nursing care plan. This is an important tool that is used by nurses, and it could be in various healthcare settings. The nursing care plan is basically a patient individualized tool that, of course, is written by an attending nurse or a nurse that is offering care to the patient. And it is also not solely written by an attending nurse, but also the patient is involved, including significant others, if it permits. It's also important to take note that the nursing care plan, as I earlier indicated, can be used in different setups that are created for the purpose of healthcare. It is mainly used by nurses and midwives, and of course, at many times, even other people or professions that are not nurses and midwives, they have used nursing care plan to evaluate their lives. And of course, I urge each one of you that, of course, this is the tool that you can use even to assess your academic life. Now, this presentation is very important even for those who are in service, and it will be very important again for those who are in school, because its focus will be on how one can write the nursing care plan. So it is a blueprint. Imagine you are constructing a house before any building materials or blocks are bought and everything. One important thing that is done is to create a plan of the house. So even the nursing care plan becomes a real blueprint to the care that is about to be offered to this patient that is in your vicinity. The other thing that is also critical is that we need to understand that the nursing care plan has the basic components, and this is based on the nursing care plan that is emanating from the nursing process. It's now the tool that we are using. So the first important component of the nursing care plan, it's the nursing problem or problems. Now, if you are writing this plan, this should be your first column. And you should understand that the nursing problems are subdivided into two. We have the potential problem and we have the actual problem. Now, a potential problem is a risk. It has not yet occurred. And an actual problem, it's a problem that has occurred and someone is able to see it. For example, under the potential problem, if it has not yet occurred, I indicated that this is a risk. And I'll give this example. You have assessed your patient, you have done your physical assessment, and you have discovered that the patient is at risk of developing dehydration. Why? Because you have seen one of the presenting signs and symptoms, it could be diarrhea. So a potential problem, it's actually pending. It's a pending problem. It has not yet occurred. An actual problem, it's something that we're able to see, and therefore it's something that needs immediate intervention. Potential problems are therefore preventable or prevented from occurring. Actual problem, they are dealt with because the problem has already materialized. So this is, again, very important to take note. Now, if it is in an examination, or if it is care that is being given by an in-service colleague, a potential problem is written starting with the word risk. And an actual problem is not written with a word starting with risk, it's just named. For example, I'll give this example. Someone presents to you with a diarrheal condition. under the potential problem, you will indicate that this patient is at a risk of fluid volume deficit. Okay, that will be your potential problem. And if we come under the actual problem, you do not add the word risk, but you just write fluid volume deficit because it has already occurred. Let's move on. The second component is the nursing diagnosis. Now, the nursing diagnosis follows the same pattern of the problem that has been identified. And therefore, the nursing diagnosis will be written in a format of a problem that has been diagnosed. For example, if this is a potential problem, by the way, before I go to that, a potential in nature nursing diagnosis has two elements. The first element is problem identified. The second one is the cause. And a nursing diagnosis that is actual in nature, it has three elements. It has a problem identified, it has the cause, and it has the evidence. And take note that the potential problem itself does not have this component of the evidence. Now, this is very important. I would still give an example of the same problem that we identified, fluid volume deficit or risk of fluid volume deficit. Now, if this is a potential problem, you will write that this is now risk for fluid volume deficit. Coming to the nursing diagnosis, how do we write the nursing diagnosis for risk of fluid volume deficit? Remember, it has two components that are very important. So we are actually going to use the same words that were used under the column of problem identified. You do not change any word. So you just copy what you wrote under the component of problem identified, transferring it to nursing diagnosis column. Therefore, this one would be indicated as follows. Since it is a risk of fluid volume deficit, when writing the nursing diagnosis, you begin by saying risk of fluid volume deficit, which is a problem that has been identified. Now, what is causing this fluid volume deficit? This is related to, for example, polyuria. Okay, if this was, of course, in a diabetes mellitus, if it is, of course, now related to a diarrheal disease, it will be a risk of fluid volume deficit related to passing of loose stools, of course, yes, all right. There will be no evidence because this problem has not yet occurred. So your write-up for the nursing diagnosis under a problem that is a potential problem in nature will just have two components. I'll try to write something underneath so that you're able to actually follow. Now, writing a nursing diagnosis, of course, which follows a problem that was identified, which was actual, it has three elements: problem identified, the cause, and the evidence. So for this one, it will be fluid volume deficit. Of course, this is not a risk because it's actual. And that fluid volume deficit for this column, it will be a problem identified. And this is being caused by the same thing which we wrote under the potential problem nursing diagnosis. So let me go through once more. This will be fluid volume deficit related to, so what is causing this fluid volume deficit? So it is related to the passage of loose stool, okay? What is the evidence? that there is fluid volume deficit. There are a lot of them. This is evidenced by, number one, of course, maybe dry skin, poor skin tagger, dehydration, or that. So this is how we jot down the nursing diagnosis. This is very, very important. The other component of the nursing care plan, it's the objective component. Now, under the objective component, we should ensure that this objective that we are writing is patient-centered, okay? And of course, it should be SMART. I've given a brief example there. When you are writing this objective, it should be patient-centered, and therefore, we are beginning our sentences by indicating that patient X or Mr. X will maintain normal fluid balance. But remember that your objective should be SMART, should be specific, measurable, attainable, relevant, and time-based or time-bound. So if you are writing this objective, we should indicate patient X will maintain normal fluid balance within, probably this will be within 3 hours of hospitalization. This is SMART in nature. Do not start your objective by using the word to, okay? To do so. No, we should begin our objectives by individualizing it to the patient. So I think this is also very important. Now, on the interventions, which is another important component, under the interventions, some would indicate phrases beginning by I will do this. It doesn't matter. You can indicate I will, or you just eliminate it and begin your phrases or your interventions that you are planning, for example, by indicating that I will administer fluids or administer fluids. So whether it is I will or you just begin administer fluid as prescribed, it does not matter. Then apart from that, under the interventions, you can also put up interventions that are coming from this patient as they engage in this care towards their healing or recovery. So hopefully the interventions are also clear. Under the expected outcome, this is another important component. So some would write it as expected outcome or evaluation. So any of the two will take it. So your evaluation is actually centered on the objective. You are evaluating the objective that you wrote earlier on, okay? So for example, you will write that the patient demonstrates, or the patient is demonstrating adequate hydration, okay, evidenced by stable vital signs, appropriate urine output, and good skin tagger. So all this is so critical and very important. You are evaluating your objective. You do not evaluate the intervention because they are so numerous. The objective is all encompassing. So your evaluation is actually based on the objective that you have listed. So thank you very much for listening and watching this video. Any questions, you can drop them down. I'll be able to respond promptly. And do not forget to subscribe.